Too much volume equals to more pain. But how low can you go? Ultrasound guidance allows targeted precision with less volume and better results.
I don't use lidocaine, xylocaine, bupivacaine, any of the canes when I'm doing a lateral epicondylitis injection. I don't want to do anything that could potentially have a negative impact on my procedure.
Watch now to discover the ideal injection approach from expert Dr. Don Buford.
This is a question that comes up very, very often, and it has to do with local anesthetics. And she says, I read that Xylocaine 2% doesn't negatively affect the platelet, and it's okay to use to numb the surface of the tendon, for example, in lateral epicondylitis. Do you agree? And then how do you control pain during the procedure?
So I don't necessarily agree, but I don't know everything. It's just my opinion. And so as a result, I don't use lidocaine, xylocaine, bupivacaine, any of the canes when I'm doing a lateral epicondylitis injection because it's just too close. I don't want to do anything that could potentially have a negative impact on my procedure. And so the second part of her question is really the key because it's the same question I had when I said, okay, if I can't use lidocaine, I mean, you know, and I'm not going to do a general anesthetic, there's got to be something in between. And the answer for me, and for most of us, I use a lot of ethyl chloride, okay? And I can often use a 25 gauge needle for lateral epicondylitis. And then the key for me is I also can concentrate the volume down.
Don't forget, if you want more about the business of orthobiologics, I have a podcast, or you can go on my website, The Business of Orthobiologics, and tune in.
So patients' pain for these relatively superficial soft tissue injections or for small joint injections is directly related to volume in addition to some other things, you know, other technique items, but the volume makes a big difference. And so, you know, many years ago, and it'd be great to have Dr. Mishra's opinion on this, but many years ago, I would inject 3 cc's and kind of flood the zone for lateral epicondylitis. With ultrasound, I can be much more precise. I can target that hypoechoic defect. I can needle a couple times, and I can put in 1.5 cc's, get the same clinical outcome based on my registry, and far less pain.
Great.
And then use ice after. I haven't found ice to be a negative thing to use after. That comes up also. So we use ice after.
Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below.